Welcome to the training on mapping social determinants of health for the Improving Community Outcomes for Maternal and Child Health project. My name is Matthew Simone, and I work for the North Carolina Institute for Public Health and the Gillings School of Global Public Health at UNC. The training today will cover map creation and methods, including social determinant of health frameworks, indicator selection, and definitions and index creation. Training will conclude with a demonstration of the story map, covering basic navigation and how to use the information and interpret the index and indicator values. We'll begin with a general overview of the project and of social determinants of health, or SDOH. First, the SDOH mapping effort is part of the Improving Community Outcomes for Maternal and Child Health initiative, also known as ICO4MCH. This initiative was established in 2015 to provide a competitive grants process among local health departments to implement evidence-based strategies to measure achievement of the following three aims: improve birth outcomes, reduce infant mortality, and improve health among children aged 0 to 5. ICO4MCH is a collaborative effort between the Women's and Children's Health Section, the Tobacco Prevention and Control Branch, with evaluation being conducted by faculty at the University of North Carolina's Gillings School of Global Public Health. The ICO4MCH project is implemented using the Collective Impact Framework and the Principles of Implementation Science. Implementation coaches from the UNC Gillings School of Global Public Health, Department of Maternal and Child Health. So the purpose of this assessment, of this SDOH assessment, is to graphically and contextually locate vulnerable populations, identify trends, consistencies, gaps, and disparities, and to provide guidance on interpretation and utilization of the SDOH data for your health impact assessment. First, let's talk about what we mean by social determinants of health. The social determinants of health are the environment surrounding an individual or household. In alignment with these guiding principles is the social determinant of health framework, of which there are many. This one is the CDC's social determinant tree, where the roots indicate the environmental inputs, for instance, either a clean environment with access to recreational facilities, or a polluted environment with toxins and unsafe recreational spaces. These social inputs will determine if an individual is sickened by pollution or is able to get adequate physical activity. This is Kaiser's buckets and bins of indicators, showing 6 main buckets which impact health outcomes. Here we see 6 categories containing multiple indicators within each category. Lastly, here is the Bay Area Health Inequities Initiative, which helpfully places each indicator into different environments according to whether they are upstream or downstream, and recognizes that moving this far upstream is emerging public health practice. We use all of these frameworks when we are choosing which SDOH indicators to map. So I want to talk now about the indicator selection process. In 2016, the North Carolina Institute for Public Health and the Carolinas Healthcare System, now known as Atrium Health, collaborated on an SDOH mapping effort in the hospital's 10-county service area. That effort started with a literature review to see how others have approached this type of work, finding many great examples across the country. We also assessed the SDOH frameworks from the previous slides and found a couple good examples of large-scale, small area mapping and index creation. We relied heavily on the approach taken in California as part of their Health Disadvantage Index, now called California Healthy Places Index. This is the same set of 12 indicators that the North Carolina Center for Health Statistics used in their statewide social determinant of health maps by health department region, which was released in the spring of 2018. We sourced the majority of our data, 11 of the 12 indicators, from the American Community Survey, or the ACS, which is updated annually by the U.S. Census Bureau. The ACS is conducted monthly with residents throughout the U.S., updated annually, and then rolled into 5-year averages. They do this to decrease sample variability and increase estimate reliability. One byproduct of this process is that changes from one year to the next will be smoothed out since it's a 5-year average. The last indicator is from the United States Department of Agriculture and their Food Desert Atlas. This data point was updated in 2015, but it relies on numerous data points from different time periods, so should be used with some caution. Finally, keep in mind that the maps represent a snapshot in time and data is consistently being collected, cleaned, and made available. These maps will look different as the data is updated, and there will be a lag between when the data was collected and when we can access it and input it. So the data will always be 1 to 3 years old. A quick word of caution when interpreting data, since it's important to always be skeptical when a figure or number is presented to you. When SDOH indicators sourced from the U.S. with SDOH indicators sourced from the U.S. Census, we know that the figures they provide us are estimates. It's a survey. It isn't a complete census, meaning we aren't going to be able to speak to every single person and get a 100% accurate picture of every single person. These data are estimates derived from reliable and valid methodology, but the reliability of each estimate should be taken into account in drawing inferences from that data. For each indicator in this map, the estimate, the universe or the denominator, and the percent are published along with the reliability of that percentage. We know that there's a margin of error associated with each measure, and that varies by indicator and it varies by geography. Look closely at the lines at the top, and you'll see the green bars. These are the error bars that indicate our accuracy of this particular measure. So this middle bar has a value a little below 4, but the error bar gives ranges showing the value that could be anywhere between 1 and 7. So that middle bar could be the lowest or it could be the highest value. All we know for sure is that the true value likely falls within this range indicated by the error bars. What they indicate is that we are 95% confident that if our measurement falls within that range, it's an accurate measurement. The smaller the range, the more precise we know the measurement is, and therefore the more reliable. With the ACS and census data, we created a coefficient of variation from the published margin of errors and calculated a reliability. Sampling error from the ACS is published as the margin of error for each estimate in percent. Using this margin of error, the relative standard error was used to derive the reliability of the percentage. Reliability categories were classified using intervals defined by ESRI demographics. Our reliabilities will be high, medium, or low. These reliabilities are published for every indicator. Some indicators should be treated with caution, such as household crowding, English proficiency, and lack of transportation. We still wanted to include them as a piece of the SDOH index. They just can't stand alone, and they should be used with some caution. So now that we've talked about data reliability, let's look at the actual data points that we collected and how we compiled them into a story map. For this project, we collected census tract data on 12 social determinant of health indicators for select counties in the 5 regions. We layered that data into an interactive online map and then created an index that presents the indicators as a single variable. Our data was grouped into 3 categories. Now we'll visit each of the 3 categories, economic, housing, and transportation, and social neighborhood, to see which data we use to create our index. The first category we'll look more closely at are the economic indicators. Within the economic domain, we had 4 different indicators: median household income, individuals living below the federal poverty line, unemployed individuals, and uninsured individuals. The median household income isn't the average or mean, but rather the middle in a range of incomes in the county. The median gives us a good picture of what the middle class income in that area is. Poverty is a key social determinant of health. Families living in poverty are more likely to live in unsafe homes and neighborhoods and are less likely to have access to health care, adequate nutrition, stable employment, and many others. The next indicator we looked at is individuals living below the federal poverty line. In contrast to the household level, this indicator measures poverty on the individual level. Note that we are looking here at the percent of individuals in a given census tract that are living below 100% of the federal poverty level, which is a function of the household size. Poverty contributes to chronic stress, unsafe living conditions, lower educational attainment, and reduced access to health care. Socioeconomic status is a strong predictor of health status, including outcomes such as unintended pregnancy, preterm birth, and low birth weight. Unemployment is measured when a respondent does not have a current employment, is currently looking for employment, and is able to accept a position should they find one. Again, this is the percent of individuals age 16 and over in a given tract that are classified as unemployed. And unemployment is directly related to socioeconomic status and is an indicator of economic stability. The final indicator in this category is uninsured individuals. This indicator is defined as the percentage of individuals without public insurance, which would include Medicaid and Medicare, or private insurance, which would include employer-provided insurance or privately purchased. Because insurance is tied to economic stability, either having a full-time job with benefits or the ability to purchase insurance, financial stability impacts an individual's ability to access preventative or routine care. Infant mortality rates are higher among women who do not receive prenatal care or who have medical problems or chronic illness themselves. So now let's look at the next domain, which is housing and transportation. This category consists of households living in rental housing, households spending over 30% of their income on rent, households who do not have access to transportation, and finally, crowded households, which is defined as more than one person per room. Home ownership is an indicator of economic stability and mobility. Households and individuals that own their home are able to build assets and can channel income that would be spent in rent into paying a mortgage, building equity and generational wealth, and investing in education or savings. Living in rental housing can increase the number of moves that families and children make, increasing their risk for poor health and behavioral and academic problems. A related metric is the percent of households that are paying more than 30% of their income on rent. The estimate of how much of a household budget is spent on rent is based on gross rent as a percentage of household income in the past 12 months. This is an accepted standard for defining housing cost burden. Families who rent rather than own their homes are more likely to spend more than 30% of their household income on housing costs. And families who spend a disproportionate amount of their income on housing costs have fewer financial resources to spend on other essentials for their health and well-being, such as food, utilities, and healthcare. These families are also more likely to report difficulties accessing health care services and are more likely to utilize the emergency room. They are also less likely to have savings that could offset an unexpected medical bill or healthcare need. For this indicator, we calculated the percentage of households that do not have access to a vehicle in a given census tract. Households that lack transportation are more likely to delay or skip seeking care. Lacking transportation is a significant barrier affecting access to employment, education, food, and many other social determinants of health. Even though this estimate often has a low reliability, we include it here because it's such an important social determinant for those lacking transportation. Crowded homes are defined as more than one person per room. This includes both living areas and bedrooms. They are linked to physical illness and psychological distress among adults and children. And children who live in crowded conditions may suffer developmental delays and emotional problems such as anxiety or aggression. So our next, third, and final category is social and neighborhood. Within this category are data on individuals with less than a high school education, households with no or limited English proficiency, households being headed by a single parent or guardian, and households in areas that have low access to food sources. Education attainment is closely tied to economic stability and socioeconomic status. Those with higher educational attainment are more likely to have higher paying jobs with benefits, including healthcare. Infant mortality rates are lower for children of mothers with higher levels of education, and children of well-educated parents are more likely themselves to be successful in school. For this indicator, we're looking at the percent of individuals in a tract with less than a high school education. According to the U.S. Census Bureau, a limited English-speaking household is one in which all members of the household 14 years and over speak English less than well. Limited English proficiency can be a barrier to seeking and receiving timely and appropriate care for both physical and mental health. It's also a risk factor for reduced health literacy and can lead to lower utilization of preventative services and difficulty or misunderstanding with medication instructions. Having parents with limited English proficiency is associated with worse health outcomes for children. This indicator is defined as households with children that are headed by a single parent or guardian. While this parent or guardian could be male or female, the majority of single-parent households are female-headed. Female-headed households are more likely to live below the federal poverty line and to experience food insecurity. Women experience gender discrimination in pay and benefits and make up the majority of workers in the lowest paid professions and disproportionately bear the burden of unpaid care responsibilities and high child care costs. So our final indicator is sourced from the U.S. Department of Agricultural food desert data. Low access to food sources in this context is defined as low access and low income. Low access to supermarkets, grocery stores, or other sources of healthy and affordable food is defined as being more than a half mile away from a store in urban areas and more than 10 miles away in rural areas. Financial stability can inform and determine where a family can afford housing. The USDA has several measures for areas with low food access, including low-income households with no access to a car. People living in areas known as food deserts may be constrained in their food choices by the inaccessibility or unaffordability of healthy foods and food retailers. So those are the 12 indicators that make up the Social Determinant of Health Index in each of their 3 domains. All 12 indicators were standardized using a z-score in each of the 3 domains, giving the indicators an equal weight in the final index value. The Social Determinant of Health Index is therefore a measure of how far above or below all 12 indicators are from the region average. In the example shown on the screen here, the darkest red indicates tracts which on average have the highest SDOH values when compared to the entire 5-county high country region. So these are high poverty, high unemployment, or high percentage of households with single parents. The only variable where this is reversed is median household income. To reiterate, the Social Determinant of Health Index is the mean z-value of all 3 domains. Index values less than 0 indicate a better than average score for the region, which we classify as above average. These will be census tracts with a higher median household income, lower poverty rate, and greater access to food. Conversely, an index value greater than 0 indicates census tracts with scores worse than the average. We've categorized these as high, medium, and low. Tracts with a high SDOH index score are tracts experiencing the greatest SDOH disparities in the region, high poverty and high housing costs, for example. So the SDOH index indicates the degree to which the social determinants of health in a given tract are above or below that region average. All right, so now I want to shift gears and take some time to see the interactive story maps. Feel free to follow along using the link on the screen. You can simply type into your browser address bar gounc.edu/ICO4MCH maps. We'll cover basic navigation through the story, including how the different regions are set up, how to pan and zoom and identify tract values, and some basics on use and interpretation of the maps. So from your browser bar, go.unc.edu/ICO4MCH maps. And when you hit return, you should be redirected to the actual URL. It'll take a minute to load, or not a minute, it'll take just a couple seconds. And these maps are set up as tabs. So our first tab here is the introduction. It gives some background on the project and includes this graphic that I just went over, that if you click on, it will enlarge, and you can see each of the indicators that we just went over. There is also some helpful information down here at the bottom about data sources, including this caution about reliability and how some indicators consistently have a low reliability and should be used with caution. You can navigate to the set of maps for your region using these buttons here, or the tabs at the top. But before I do that, I want to highlight a couple things on the main mapping screen here. You can click and hold to drag the map around to match the extent that you're interested in. You can roll your mouse wheel in or out to zoom in or out. And if you get disoriented and out of place, you can always hit the home button up here, which will bring you back to this full extent. You can also use the plus symbol here or the minus symbol to zoom yourself in and out. Hitting this button will show you where you are on the map if you allow location access. So it'll put a dot on the screen showing you where you are relative to the rest of the maps. And you can also search address locations using this option here. So if I type in a city, or you can type in a specific address, it will take you to that address, put a dot on the map to give you that perspective. And again, if you zoom out to full extent, it'll show you that. The final thing I want to highlight is that the ability to see all of the indicator values for the county. So clicking on a particular county will show you all of the values that we have, all the indicator values for that county. So we know that according to the latest census data, 2013 to 17, American Community Survey 5-year averages, the population in Ashe County is about 27,000. Poverty rate is just above 19%. Total unemployment rate is 5.2%. And uninsured is 13.9, etc. We have all of the indicator values that I just went over averaged for the entire county here. So you can do that for any one of the ICO4MCH counties. Okay, so now let's jump into one of the region-specific maps. We'll look at Region 5, the Sandhills Collaborative. The first thing you might notice is that we have some missing data here. These are the areas that are hatched, and it indicates census tracts where we have no population, or in some cases, limited population data. In this case, this is Fort Bragg. So the setup is pretty straightforward. On the far left, we have the beginning of the story indicated by the home icon. And then we have each of the chapters as dots. So we start with economy, and then move into housing and transportation, social and neighborhood, and finally the index chapter. Let's start with the introduction here. Clicking on these gray buttons will toggle between the different layers that we have as options. So we have total population or population density, which as you can see show distinctly different patterns. You can also turn the layers off. And as you scroll down, you'll see the rest of the story in this first introduction tab. You have different race ethnicity options here. And again, you can turn the layers off if you would like. Let's take a look at the first chapter, economy. You can get to that by either scrolling into the chapter this way, scrolling down, or you can click on the dot over here. So again, clicking on these gray dots will toggle the layers on and off. We're looking at median household income here. Shows a distinct pattern. Poverty also shows a very distinct pattern with some high poverty tracts centered around the Fayetteville area. Let's go ahead and take a look at one of these tracts. You can click and drag, zoom in, and start to get a better idea of where we are on the map. So you can turn it off, turn it back on, you can zoom in, turn it off. So now you can get a better sense. As you zoom in, you're going to get more detail in these roads. Certain names will show up. So turning poverty back on, this is the region that we'll look at. When we click on the map itself, you'll see that this is census tract number 38. We have an estimate of about 3,000 people here, and 40% of them are living in poverty. And here's our margin of error. So this is our reliability. Our margin of error here is plus or minus 7.1%. So the poverty rate could be as high as 46% here, or it could be as low as 32%. And that is, we feel fairly good about that estimate. That's a high reliability estimate. You'll see that some of them are medium reliability, and you'll see that that is here 14% poverty plus or minus 15.5. And now as you switch between the layers, you'll see that the legend up here in the upper right changes. So now we have median household income. We can switch back to poverty. Now we have percent of individuals living in poverty. So again, hitting home will bring you back to the full extent. One more thing I would like to highlight here is this last button here. We have a more info link, and it says Census Reporter page. When I click on this, it's going to bring up a new tab, and it's going to show me more information about this tract, a lot more information. So this is a tract where the median age is 35.2. This is the age distribution. We have gender, sex, race, ethnicity, income information, poverty. A lot of these we have in our maps already, but we don't have information like this: transportation to work, marital status, some fertility information. So a whole wealth of information associated with that tract. So this is the Census Reporter page. You can even see the data that's associated with these. So you can see the percents and the margin of error, which is helpful. So that is the Census Reporter page. That's going to be available on every single tract that you click on. And you can stay on that page. You can interact with it like you can with the maps that we've made, just by clicking on the adjacent track if you want to find more information about it. Okay. So let's look at the rest of the chapters of the story now. So housing and transportation. These go in the same order as that graphic, the same order as were just presented in the PowerPoint. Housing transportation is our next indicator. We've got renter-occupied households, renters paying more than 30% of their income on rent. And in this case, these are showing pretty distinctly different patterns. Crowded households is the next variable, as is transportation, lack of transportation. And this is where we encounter the first indicators where we have this warning, where we say, of all the ICO4MCH tracts in the region, over 40% of those tracts have a low reliability. So we can get that sense here by turning on the crowded layer. You see the dark purple are the ones that are most crowded. These are the ones that will actually have probably a medium. I don't think we have any high reliability estimates here. But these are the ones where you should have, in some cases, a higher reliability estimate. Here's a good example of what we mean by low reliability. We estimate that there are 1,300 households in this tract, and 108 of them we think are crowded. So that's roughly 8.3%. Our margin of error, however, is 8.2%. So that's almost 100% of the estimate. So we either have 108 households here, or maybe just 0.1%. So this is a low reliability estimate. So any time where you have this, you should certainly interpret it with caution. Some of these other ones, you're going to have a medium reliability estimate. So 9.6% of the homes are crowded, plus or minus 4.9. Not great. But anywhere where we have a low number of crowded households, or 0, I think this one, yes, this one has 17 crowded households. and we estimate that to be 0.8%, but the margin of error is double the estimate. So that's definitely a low reliability estimate. Can't really put much credence in this estimate here. So that's housing and transportation. Now we have social and neighborhood, education less than high school, limited English speaking households. This is the final of the 3 indicators that we say use with caution. And here is a good example of that. So some medium reliability estimates. Some of these we have, let's see if we can find one. Here's one where we estimate 11 households speak English less than well, and that's 0.9% plus or minus 1.4, so low reliability. Single parent households, another one, and then the final indicator is access to healthy foods. And we've mapped this 2 different ways. One way, this is the variable that is in the index, and that's the percent of individuals who are classified with low access to food. And that includes, there's 2 criteria here. If it's low access to supermarkets or places that sell healthy food, as defined by a distance to the closest retailer, and it has to be low income. So the USDA estimates that of the 2,300 people that live in this tract, about 1,900 have low access to food. Another way to look at this is just in a binary, it either is or isn't a food desert. And this includes transportation as well. So this is where low-income census tracts where more than 100 housing units do not have a vehicle and are a certain distance from the nearest supermarket, or a significant number or share of residents are more than 20 miles from the nearest supermarket. Okay, so now let's look at the final chapter. This is a chapter where we roll everything up into a index score. So we took the 12 indicators and averaged them into a single value. These dark red areas, again, indicate the neighborhoods with the highest social determinant of health disparities. In the example on the screen, I've highlighted the tract with the highest SDOH index score in the region. So that would be up here north of Fayetteville. So it's highlighted here, and then it's also highlighted in the text here. So this is Census Tract 2401. It has a poverty rate of 38.5. 63% of the homes are renter occupied and are paying more than 30% of their income on rent, and almost 70% of the households with children are headed by a single parent. So all that information is summarized in here. As you scroll down, we have the actual index value and what we're categorizing as, which is high. And then you have the z-scores for each of the domains and the actual percents for the indicators. So 38.5% in poverty, and that is high for the region. Unemployment at 15.7% is actually not the highest for the region, still very high. It's higher than the state average. And as you see, all of the indicator values in this particular tract are some of the highest for the entire region. So those are the maps, and I encourage you to take some time exploring your regions to see which neighborhoods are experiencing the highest social determinant of health disparities. We believe the impact for positive change will be greatest in these areas, and as you're designing health improvement interventions, keep these neighborhoods in mind. Will lack of transportation be a barrier? What about single parents? Designing programs with these social and environmental factors in mind is critical to improving the health of our communities. So that concludes the training. Encourage you to, if you want to follow up, reach out to me. If you want to find out more about Gillings or Institute, you can follow the links on the screen. And that is all. Thank you very much.